Dealing with an enlarged prostate can be both uncomfortable and concerning. However, there are certain important steps you can take to deal with this issue and regain control of your prostate health. In today's video, we'll walk you through 10 straightforward yet effective measures to help shrink an enlarged prostate. By adding these steps into your daily routine, you'll be on your way to finding relief and supporting a healthier prostate. So let's get started. Number 1. Avoid too much sugar in your diet. When you eat sugar, it enters your bloodstream and causes your blood sugar levels to rise, and in turn, releases insulin, a hormone responsible for regulating blood sugar levels. Insulin in high amounts can bind to a receptor for IGF-1, or insulin-like growth factor 1. IGF-1 causes your cells to grow and multiply, including the ones in the prostate. So when you keep consuming sugary drinks and desserts, it keeps your insulin levels consistently high, which can cause excessive growth of your prostate cells, leading to the development of an enlarged prostate or benign prostatic hyperplasia. Number 2. Avoid eating starchy foods, including whole grain products. Wheat flour or whole grain products contain starches. As you chew these foods, an enzyme in your mouth called amylase begins breaking down the starches into sugar. The broken down sugar from grains enters your bloodstream, causing a rise in blood sugar levels. By avoiding grains in your diet, you're minimizing the source of starches that get converted into sugar. This helps to maintain stable blood sugar levels and prevent the overstimulation of prostate cell growth. This, in turn, helps to tackle the hormonal factor that contributes to an enlarged prostate. Number 3. Avoid soy products unless they are fermented. Soy contains compounds known as phytoestrogens. These are plant-based compounds that mimic the effects of estrogen in the body. Estrogen is the dominant sex hormone in women, but men also have small amounts of it. In fact, an imbalance between estrogen and testosterone in males can cause prostate issues, including prostate enlargement. Phytoestrogens in soy bind to estrogen receptors in the body. This estrogenic activity, in contrast to testosterone, can contribute to prostate enlargement. However, the fermentation of soy, as seen in traditional Asian foods like natto, miso, and tempeh, alters the chemical composition of soy, so it's not too effective to cause hormonal imbalance. Number 4. Opt for full-fat dairy products rather than low-fat options. Yes, you heard that right. Many people think that all dairy products are bad, especially for people going through hormonal issues. Full-fat dairy products like milk, cheese, butter, and yogurt contain saturated fats. These fats can positively influence the testosterone levels in men. In fact, your body needs saturated fats for the production of sex hormones, including testosterone. Avoiding low-fat dairy products is also equally important if you have an enlarged prostate or imbalanced hormones. They are usually low in saturated fats and often contain estrogen-like chemicals in them, which can seriously disturb your hormonal balance. High-fat or full-fat dairy is also rich in many fat-soluble vitamins, such as vitamin A, vitamin D, vitamin E, and vitamin K, which can be really good for your overall health. Vitamin D is particularly important for prostate health. It has been linked to a reduced risk of prostate cancer and plays a role in preventing or slowing the progression of the disease. Number 5. Avoid consuming ultra-processed vegetable oils. Vegetable seed oils, such as soybean oil, corn oil, and sunflower oil, are usually high in omega-6 fatty acids. Although omega-6 fatty acids are essential for our body, having more omega-6 and less omega-3 can be a bad thing. According to experts, the ideal ratio of omega-6 to omega-3 fatty acids in the diet is around 4:1 or lower. In other words, for every gram of omega-3 fatty acids you consume, you should ideally consume no more than 4 grams of omega-6 fatty acids. However, most Western diets are usually high in omega-6 and low in omega-3. This imbalance can cause systemic inflammation, which can affect various bodily systems, including your prostate. Vegetable seed oils promote an inflammatory response within your body due to their high omega-6 content. This inflammation can worsen your symptoms of an enlarged prostate, such as difficulty urinating, frequent urination, post-urination dribbling, and others. Instead of those ultra-processed vegetable oils, opt for minimally processed and healthier kinds of oils, such as olive oil, avocado oil, and healthy fats from nuts and seeds. They usually contain more omega-3s, which help reduce inflammation in your body, including your prostate, and may even help relieve your symptoms of an enlarged prostate. Number 6. Adopting a low-carbohydrate diet, such as ketogenic or carnivore. Ketogenic diets in particular cause a state of ketosis, where your body starts using stored fats for energy instead of glucose. In other words, your body is going to rely more on fats and proteins for energy rather than sugars, which prevents your body from producing too much insulin, which could trigger IGF-1. Another thing is that being on a low-carbohydrate diet helps you lose extra body fat and improve insulin sensitivity. Eventually, this can help reduce inflammation in your body, leading to a lower risk of developing prostate-related issues. Number 7. Practice intermittent fasting, with fasting periods ranging from 14 to 18 hours. Fasting periods help regulate insulin levels. When you're not eating food, you won't be taking sugars, and your body won't have to release insulin to process them. Another cool thing is that during fasting, your body enters a state of autophagy, which is a natural process of cellular repair and regeneration. This can indirectly cause your body to repair the damaged cells and tissues, including the ones in your prostate. Fasting has also been shown to reduce inflammation, which, as you know, can worsen your symptoms of an enlarged prostate. Number 8. Supplementations and medications. Supplements like saw palmetto, nettle roots, and pumpkin seed extract are some of the best natural supplements that you can use to treat hormonal imbalances. Saw palmetto, for example, is often used to treat hormonal issues in both men and women. Nettle roots and pumpkin seed extract, too, have hormone-regulating properties. Another supplement is metformin. As mentioned before, BPH has been associated with insulin resistance and metabolic syndrome. Metformin can improve insulin sensitivity, which can indirectly help to relieve BPH symptoms. Number 9. Hormonal replacement therapy. HRT makes use of certain medications that inhibit the production of 5-alpha reductase. This enzyme is mainly responsible for the conversion of testosterone to dihydrotestosterone, a more powerful form of testosterone that triggers the growth of prostate cells. Sometimes alpha blockers are also used to help relax the muscles in the prostate and bladder, which helps to relieve the urinary symptoms of an enlarged prostate. Number 10. Stress management. During times of stress, your body releases cortisol, which increases your blood sugar, so your body has to release insulin to balance that sugar. Consistently high stress, also known as chronic stress, can cause your insulin levels to stay consistently high. This can not only cause insulin resistance, but can also trigger the release of IGF-1, leading to an increase in prostate size. So it's crucial to avoid taking too much stress. There are many stress-relieving techniques that can help bring down your stress levels, like mindfulness meditation, deep breathing exercises, dancing, yoga, and something as simple as listening to relaxing music. Make sure to like this video and subscribe to the channel to support our mission to help improve your health. Thanks for watching and see you in the next video.